Do you know what triggers a migraine? A question often asked, yet the answer remains elusive to many. Migraines, contrary to popular belief, aren't just your run-of-the-mill headaches. They are a neurological condition, a complex disorder that goes beyond the confines of a simple headache. Migraines are characterized by intense, debilitating headaches, often accompanied by a myriad of other symptoms. Picture a pounding headache so severe, it feels like a drum beating relentlessly inside your head. Now, magnify that image. That's the intensity of a typical migraine. But it's not just about the pain. Migraines can also bring about nausea, vomiting, and extreme sensitivity to light and sound. They can last for hours or even days, making everyday tasks seem like insurmountable challenges. Indeed, migraines are not to be taken lightly. They can significantly impact an individual's quality of life. So now that we know what migraines are, let's delve into the symptoms. Ever wondered how to identify a migraine? A migraine is not just an ordinary headache. It's a neurological condition that's often characterized by intense, debilitating headaches. The symptoms can be so severe that they interfere with your daily activities. But how do you know if what you're experiencing is a migraine? Well, one of the most common symptoms of a migraine is a throbbing or pulsing pain, typically on one side of the head. This isn't your regular tension headache that feels like a tight band around your head. It's a severe pain that's often described as pounding or throbbing. Another common symptom is sensitivity to light and sound. During a migraine attack, you might find that bright lights and loud noises are unbearable. Even ordinary light can seem too bright, and normal sounds can seem too loud. Nausea and vomiting are also frequently associated with migraines. This isn't a mild case of feeling a bit queasy. It's a strong feeling of sickness that can lead to actual vomiting. Then there's a symptom that's unique to migraines: the aura. An aura is a series of sensory and visual changes that can occur before or during a migraine. Some people see flashes of light, zigzag lines, or shimmering spots. Others might experience tingling on one side of the face or in an arm or leg. It's important to note that not everyone who has migraines experiences all these symptoms, and the intensity can vary from person to person. For instance, some people might have migraines with aura, while others might have migraines without aura. And it's also worth noting that these symptoms can start a day or two before the actual headache hits. This is known as the prodrome phase, and it can include symptoms like mood changes, food cravings, neck stiffness, increased thirst, and frequent yawning. Understanding these symptoms can help identify migraines, but what triggers them? What if you could avoid migraines by understanding their triggers? This question may seem like a dream to some, but it's a possibility that's closer to reality than you might think. Let's dive into some of the most common triggers of migraines. First up is stress. Whether it's work-related, personal, or even just the stress of everyday life, it can be a major catalyst for migraines. It's important to find ways to manage and reduce stress, such as through meditation, exercise, or simply taking time for yourself. Next, certain foods and drinks can trigger migraines. Some culprits may include aged cheese, processed foods, and alcoholic beverages, especially red wine. Also, caffeine can be a bit of a double-edged sword. On one hand, it can provide relief from a migraine in progress, but on the other hand, too much of it, or sudden withdrawal, can trigger migraines. Sensory stimuli, such as bright lights, loud sounds, or strong smells, can also set off migraines. It could be the intense glare of the sun, the piercing sound of a siren, or the powerful scent of a perfume. Changes in your wake-sleep pattern can be another trigger. This could be due to jet lag, shift work, or even just a late night out. Regular sleep patterns can play a key role in avoiding migraines. For women, hormonal changes can be a trigger. These changes can occur during menstruation, pregnancy, or menopause, and may also be influenced by oral contraceptives. And finally, changes in the environment such as shifts in weather or barometric pressure can trigger migraines. It's not uncommon to hear someone say they can sense a storm coming on because they feel a migraine starting. The triggers we've discussed are common, but it's important to remember that everyone is unique. What triggers a migraine in one person may not affect another. It's a bit of a puzzle, but one that's worth figuring out. Identifying personal triggers is crucial in managing migraines. But what if a migraine still hits? Stay tuned as we delve into the treatment options in the next segment. Caught in the throes of a migraine? There are treatments that can help. Let's explore the various treatment options available that can aid in both preventing and relieving the pain of migraines. Treatments for migraines can be broadly categorized into two types: preventive and pain-relieving. Preventive treatments aim to reduce the frequency and severity of the migraines, while pain-relieving treatments focus on easing the symptoms once a migraine has already started. When it comes to preventive treatments, medications are often a go-to strategy. Doctors may prescribe medications originally developed for epilepsy, depression, or high blood pressure, as these have been found to be effective in preventing migraines. It's important to note that these medications are not a one-size-fits-all solution. What works for one person might not work for another, so it may take some time and patience to find the right medication for you. However, medication is just one piece of the puzzle. A key aspect of preventing migraines is making certain lifestyle alterations. Regular physical exercise, for instance, can help reduce tension and ward off migraines. Whether it's brisk walking, cycling, or yoga, any form of regular moderate exercise can be beneficial. Getting enough sleep is another crucial factor. Migraines often strike when we're sleep deprived, so maintaining a regular sleep schedule is of utmost importance. Aim for 7 to 9 hours of quality sleep each night. Keeping yourself well hydrated is also essential. Dehydration is a known trigger for migraines, so make sure you're sipping on water throughout the day. Try to avoid drinks that can dehydrate you, like those high in caffeine or alcohol. Stress is another common trigger for migraines. Engaging in regular stress management practices like meditation, deep breathing exercises, or even just reading a good book can help keep migraines at bay. Now, let's talk about pain-relieving treatments. These come into play once a migraine has already started. Over-the-counter pain relievers like ibuprofen can be effective for some people. For more severe migraines, there are prescription medications available that can help to stop the symptoms. Again, it's important to discuss these options with your doctor, as what works best will vary from person to person. In some cases, a combination of medication and lifestyle changes may be the most effective way to manage migraines. This is where personalized treatment plans come into play. Your doctor can help you develop a plan tailored specifically to your symptoms and lifestyle. This might involve a combination of medication, dietary changes, stress management techniques, and other lifestyle modifications. Managing migraines might seem daunting, but with the right knowledge and help, it's possible. Remember, you're not alone, and there are many effective strategies available to help you navigate this challenge. With patience, perseverance, and the right treatment plan, you can regain control over your migraines and improve your quality of life. Let's recap our journey into the world of migraines. It's been a fascinating exploration of this common and often debilitating condition that affects millions of people worldwide. We've learned that migraines are not just ordinary headaches. They are neurological events characterized by intense throbbing pain, usually on one side of the head. Accompanying symptoms can include nausea, vomiting, and sensitivity to light and sound. For some, an aura, a type of sensory disturbance, may serve as a warning sign before the onset of the migraine. We've also delved into the complex web of triggers that can set off these painful events. Everyday factors like stress, certain foods, changes in sleep patterns, and even changes in weather can be potential triggers. It's a highly individual experience, with triggers varying from person to person. But it's not all doom and gloom. We've also discovered that migraines can be managed and treated. There are a range of options available, from over-the-counter medications to prescription drugs to lifestyle changes and alternative therapies. It's important to remember that what works for one person may not work for another. It's a process of trial and error to find the most effective treatment plan. In our journey, we've also emphasized the importance of keeping a migraine diary. This is a valuable tool that can help you and your healthcare professional identify patterns, triggers, and effective treatments. So there we have it. Migraines are complex, but they're not insurmountable. Knowledge is power. The more you understand about migraines, their symptoms, triggers, and treatments, the better equipped you'll be to manage them. Remember, understanding migraines is the first step to managing them. Consult healthcare professionals for personalized advice and stay healthy.